Well, welcome everyone. We're happy to have you here. We are going to have the opportunity to have a conversation with you about what is the CPT program, the requirements, and the process itself.
And they need us to come to vote.
Right now in this presentation, we have Kathy McGuinness. She's the Director of Workforce, and myself. My name is Ilonka Stoll. I'm the Participants Manager. And here we together oversee the participants' journey from the moment that they start their interest form. We walk with them through the application process, and then when is their academic life, and when the commitment, the 3 years commitment comes in place. So if you allow me. Can you see my screen? The FLIPS Workforce Investment Organization WIO slide? Thank you. Well, we are going to talk briefly. Today, we're going to talk about what is the Workforce Investment Organization, a little bit as well, the 1115 waiver, and what is the process, the CPT application process. And at the end, we're going to have a time for us to for you to present your questions that you might have. If you want, you can save them for the end of the presentation, or you can post them in the chat as well. Well, basically, what is FLIPS? FLIPS was established 10 years ago in 2015 as part of the New York State Deliberate System Reform Incentive Payment. Is really long, and the short term is DSRIP program. And the goal in that program was a mission to transform the healthcare delivery for Medicaid and uninsured populations within the state of New York, as well as my understanding that California, they had a program, similar program. Our mission was to reduce the 20% all available hospital use and improve clinical outcomes across the 13 counties region that we call the Finger Lakes area. We have served over 400,000 individuals through a network of over 6,000 providers and 19 hospitals through the Finger Lakes region. Through the last 10 years, FLIPS has implemented 11 major projects related to behavioral health, integration, chronic disease management, care transition, housing, and to improve the collaboration among providers and rural and urban areas. As well, part of our what our FLIPS has done is being part of the workforce improvement. So here, when we're saying we have been working with the community programs, supporting partners, providers, and health systems, and improving workforce. Well, what is the CPT program? We are FLIPS was assigned as one of the New York State designated work investment organizations here in the state of New York. The short term is WIO. So you hear me saying WIO is the short name for Workforce Investment Organization. We have been approved by the Department of Health to support the workforce development initiatives, primarily in healthcare and long-term care sectors. We are tasked with providing education, training programs to strengthen the healthcare workforce, including career pathways for new and advanced new entrants and advanced opportunities for existing workers. So those are the two pipelines that we have. As well, we have what is the reason for the wheels is we are addressing the workforce shortage that we have in the and health disparities that we have focusing on, especially on underserved communities. Under the umbrella of the WIO, the CPT program, we are offering resources, like tuition assistance, mentoring, specific training to build a reliable pipeline of qualified professionals in roles such as nursing, mental health counselors, and social workers and home care staff. Essentially, a WIO is a regional administrator and training partners that ensures that in the state of New York, the healthcare system has a skill and sustainable workforce. Here, as well, what is the 1115 waiver? Is the New York State Health Equity Reform 1115 waiver. Right now, it was approved, the CMS on January of 2024, they made an amendment for the 1115 waiver that provides us over $7 billion to transform the healthcare delivery for Medicaid members. The goal of this program is to advance health equity, reduce health disparities, integrate social care with healthcare, and strengthen the workforce. Under this umbrella, we have social services related to housing, nutrition, transportation, case management, social care networks, and we have launched, the 1115 has launched in 2025 to screen Medicaid members for social needs and connect them with resources, social determinants of health. But right now, what Flip's role that we have and the involvement, the piece that we play here under the umbrella of the WIO, we are here to support the investment to address in workforce development, to support investment to address shortage and improve provider payment rates for primary care, behavioral health, and social services. We do data integration, and basically what we did in the past related to the district program, we are following with this, the CPT program. Right now, with all the changes that are happening and are taking right now in place with the government, we can, the Department of Health has confirmed that the CMS will continue to honor the terms of the New York State Department of Health, the terms and conditions through the remainder of the demonstration period. The CPT program started on 2015, 2025, early January, and is to end by the spring of 2027. That's why it's so important to know that right now we have the support that the program is going to be in place until the spring of 2027. And as we were sharing, Flips, the CPT program, we are one of the WIOs, one of the organizations in the state of New York. Right now, the state of New York has 3 organizations covering, because it's such a large area. We have what we call in the Region 1, if you see in the slide, what is highlighted in yellow, downstate area. That's what we call the Region 1. This is the organization that is taking care of the CPT program is $11.99. We, as well, if you see on the top, we have what we will call upstate central New York area. That's we are region 2. And the organization that is taking care of that area is Caring Gene. And right here on the left side, you can see like a blue light. That's what we call region 3, Western New York, mostly. We are FLIPS, is covered by FLIPS, the CPT program. Why is we are sharing this with you? Because one of the requirements how you can apply to the program is based on the where your residency. If you live in Albany, you need to apply through that will be, I think, will be through Caring Gene. If you live in New York City, in the Bronx, for example, you will apply through $11.99. If you live here in Orleans, Wayne, for example, you will apply through FLIPS. It's very important that you have this take in consideration where you are applying. It's not based where the school is located. It's based where you live, your legal residency. So it's important that we keep this in mind because we have some participants that they go and apply through a out of network, we will say, saying that they might live in Bronx, but they apply through FLIPS, through the Western New York. That could delay the application, and add extra steps. So please keep in mind, wherever it is your residency, the county where you reside is the agency that you need to apply. The Career Pathway Training Program, what we call in short CPT program, we were launched under the umbrella of the New York Health Equity Reform 1115 waiver. The reason for this program is to strengthen the healthcare workforce by funding education, training, and job placement for new and current workers that are seeking advancement. The goal is to create reliable pipelines of health, behavioral health, and social services, social professionals to address the statewide workforce shortage. As we all know, recent events, we are aware of the struggles that the healthcare services are going through. So the program timeline runs through until March 31st, 2027. That's where the commitment, and then the service commitment is extending to 2031. Basically, in a quick snapshot, what is the CPT program? As I mentioned before, on the blue screen area, we have mentioned we have 2 career pipelines. One is intended for the advancement pipeline. Those are for individuals that are currently working in health, behavioral health, or social care services, but they want to go to the next step. And the second pipeline is for the new careers pipeline. These are for individuals who are unemployed or are not currently working for a New York State behavioral health, behavioral, or social care provider, but they want to start their path in healthcare services. Through the program, you are going to receive participants. We are covering what is the application and enrollment assistance, tuition coverage to the last last dollar. We're going to explain that, what that means. Educational case management, from when you start the process, maybe you need a guidance. You have not selected what school, you have not started your process from FAFSA. Our case manager team, management team, they will work with you. They will guide you in all the services that you need. As well, we have tutoring services. We for yes, healthcare, health science are hard. So if a participant is struggling, we are offering the tutoring services, any services that they might need so they can accomplish their goal. And by when the time comes, we are implementing a program for a mentorship and to get them ready for when the time comes by the time that they graduate. We are also helping with employment placement assistance. And that's what is in the middle, and in the middle of the page. Then on the left side, we have what is the CPT program details. This program is intended only for individuals who have not yet started the educational program and or training program, and it can be covered by the CPT program. We are scheduled to expire by March 31st of 2027. That means that all programs, academic programs, must be completed by no later the spring of 2027. Some schools might be early May, some schools end of May, and other schools by maybe through June. But after June of 2027, we cannot support that. That would not make that's not eligible for the program. So the graduation date could be later in the year. That doesn't make a difference. But yes, you need to all the academic programs must be completed by May or June of 2027. After you graduate, when you have been approved for the program, you have gone through your academic life, you are gonna, by the time that you graduate, you are required to complete a 3-year full-time service commitment at a New York State a provider that serves at least 30% of the population that they serve is either Medicaid or uninsured recipients. This and the 3 years service commitment needs to be completed by December of 2031. As we shared with you before, on the CPT program, we cover tuition. On the right side of the screen, you can see that what we cover. The CPT program covers what is the tuition, any program fees, any required program fees, exams, textbooks, scrubs, uniforms, supplies such as any kind lab or clinical supplies that the school requires for the participants. They are covered by the program. Educational case management through day one to the time that you complete your service agreement is all the way along. And then as well, academic support. That's something to keep in mind, that for you to know that we are going to be here on your side, working with you to support you. Sadly, yes, there are a couple of things that the program cannot cover because the nature of the program. Like a room and boarding, meals, living expenses, or any other incidental expenses, they are not covered. Expenses related to transportation or parking, they are not covered. technology, such as laptops or tablets, cell phones, sadly, they are not covered. The background checks, we cannot, the program doesn't cover that. Vaccines, drug testing, health insurance, that is not covered by the program. By the time that you, I think it's for some of the programs, you are required for an N95 fit testing. Basically, is this mask. That piece is not covered by the program. Also, we have some CPR, if there is a certification like CPR, that is not covered by the CPT program. And sometimes some schools, they might be, it goes from school to school. We have some expenses that might not be part of the tuition, that please just share them with us. We will work with the school, and what is we are able to cover, we will cover it for you. By the time that you become a CPT participant, you have been approved for the school. Please do not make any payments out of pocket. The reason for this request is because we cannot reimburse, we cannot make payments to individuals. We can, sadly, we can, the program has been designed to pay only to the schools. Well, so as any program, we have requirements. What are the CPT program requirements? Basically, we have the most important is that there's a United States citizen or an eligible non-citizen. Then we also have the participants, by the time that they apply or the time that they have to start their academic program, they have met all educational or training program requirements based on the selected CPT title on course of study. So any prerequisite course or any other maybe practice, certification, volunteering time, they need to be that is required by the school. They need to be completed by the time that you are gonna start the the prerequisites, training, volunteering hours that are required before the program starts. They have to be completed. As well, we have the participants must be a New York State resident or a resident within boarding line state, like New Jersey. We have with Connecticut, Philadelphia, Pennsylvania, Massachusetts, and Vermont. Those are because the nature of the region, we have individuals, they might live New Jersey, but they drive to New York, they cross the border to work in the state of New York. If you live in any of those states, in the bordering states, but work for a health provider in the state of New York, you are eligible for the program. You can apply to the program. If you live in in New Jersey, but you do not work for a health provider in the state of New York, you cannot apply through under the CPT umbrella. And then, yes, the requirements that you as a participant need to be aware that you are committing to serve a 3-year full-time employment in a New York State Medicaid enrolled provider who serves at least 30% of the population that they serve are Medicaid members and or uninsured individuals. This, the provider needs to be attested and approved by the state. That's one of the, that we're gonna talk about it in a little bit, is a requirement is, it has to be approved by the state. And well, those are the main requirements that we have for the program as well. Yes, you have to yourselves, you need to apply to the schools. You need to take, if they take tests, all the requirements that the schools ask, you have to go through them. Leila, I see that you have a question.
Hi, thank you giving me chance to ask my question. Actually, I used to work in New York State for 5 years with New
Mhm.
York Blood Center, and the building, the center that I used to work there, for demolishing the building and just making new building. That reason because they just close the site, and for the reason that I don't want to go to detail, our group, research group, like position terminated. So when I applied, I was under unemployment in New York State. I just got your portal or like website information from there, and I applied. I opened the account, and right now, first of all, I want to see if I'm not working right now, even I just work for healthcare in last 5 years, am I eligible or not? I'm living in the New Jersey by the bridge, Fourthly.
So right now you are not working in New York State for a health provider, right?
No, but when I create account, I was working.
Mm-hmm, mm-hmm.
Yeah. And also right now, I have my account, and I logged in to just tell you that it's under 1199 SEIU. My application showing like that.
Mm-hmm.
Training and sorry, employment funds, and there is like three section: open task, my request, program, service, enrollment. And one of task that shows like case number, when I open it, it shows one pending requirement I have to submit. But
Mm-hmm.
there is no option. I couldn't just reach anyone to get help in this matter. They asking for school fees
Mm-hmm.
and bills. How
Okay.
could I get help? You told when you started you have to ask your advisor or someone just help you. But unfortunately, even I call the number, but it goes to automatic, answering machine, and not none of those options apply to me. I don't know what to do.
Don't worry, Leila. If you don't mind, at the end of the presentation, we're going to share our email address. Please send us an email, and we're going to give you a call so we can talk more in detail and learn what we can do. Okay?
Yes, and also I want to mention that I accepted for nursing program starting in January, and that is the time we have to start to pay. So you told no payment to individual, you're gonna pay school. So I want to learn this as quick as possible.
Yes, yes. So that's part of the application process, and then when you become a participant, the CPT program, we handle all the administrative piece directly with the school, payments, and all tuition, uniform, textbooks. That's done directly with the school. So please send us an email. We are gonna share at the end of the presentation. We're gonna give you an email address so we can have a conversation. Send it to either Kathy or myself, and we're gonna be more than happy to give you a call and talk about it.
Thank
Because based on where you live, New Jersey, you need to stay with 1199. Okay, but we're gonna call you, and we're gonna to discuss the case. Okay.
Okay, thank you.
Well, thank you. And then when we
I
have,
have a question. Can I please speak?
I'm sorry,
I have a question.
please go ahead.
Okay, so so first, I wanted to ask is that you mentioned that the program will only cover the tuition up to fall or like June 2027, correct?
Correct. Until the spring of 2027. Correct.
Okay, and then after that, let's say after that we would have to pay out of our pocket, correct?
No, no. Actually, you must complete the whole academic program. The academic program needs to be completed by the spring of 2027.
Yes, but what about if so I'm thinking about counseling, and the counseling programs, they are usually like the school that one of the program I looked into, it's like 3 years program.
Mhm.
So,
Well,
so
if you visit we have a list of schools, and you can visit them and have a conversation with them, because all depend on the length of the program. Right now, the time is going too fast. Seriously, it feels like in a blink. So we have actually we have, out of the 13 job titles that we had at the beginning, right now we have about 10, only 10, because yes, there are programs that they cannot be completed before by the spring of 2027. And then sadly, we cannot cover after that. We cannot fund that application.
okay, uh, um so then let's say if I were to start, so I would have to look for a program that is like a 1.5 year, like 3 semester program.
Correct. Yes.
Okay. And you said that there are the school universities that you know of, that this program um, uh, is like like there are programs that are 3 weeks long, not sorry, not weeks, 3 semesters long, that you guys have contact with, like you guys have contract with.
Yes, we have right now a list of 42, I think, if I'm not wrong, 42 schools through mostly Western New York, some of
Mm-hmm.
the central area,
Uh-huh.
central New York. Some of the schools, they have online programs. Some of them are combined, a hybrid style, and then some in person. Each school, the program, is not the same length. Each
Okay.
they have their own path. So that's something that you will need to have the conversation with the school. Sometimes participants, they have some credits that they bring from other programs, or if they are already in this, they have a degree already that can
Mhm.
short the length of the actual academic plan. But that's a conversation that will need to take place between you, the educational case manager assigned to your case, and the school. But
Okay.
yes. Mhm.
Okay, and then where do I see those the schools that you guys have contract with?
Yeah, we're gonna share that information with you in a moment.
Okay, and then one last question. So because I did the application where you go on the website and you request for more application, uh, um, like a link for that. I
Mhm.
did that, but I haven't received anything. So I'm wondering if, like, how can I do all this entire application?
If you are kind, please, in a few minutes, we're gonna be sharing an email address with you,
Okay,
as well as we asked Layla, please send us an email, explain
okay,
the situation, and we're gonna get back to you so we can go in deep with the conversation, okay?
okay. Thank you so much.
You're very welcome. Well, I'm sorry, we were talking about um, one of the requirements, participants, we need to apply financial aid, FAFSA, or the TAP, the Tuition Assistance Program. We understand that some of the programs, they are not eligible for this two fundings, but if they are available, you need to apply. If you are eligible, good. If you're not eligible, good too, because we will fund it. The CPT program is intended to be used only as covering the tuition gaps. last dollar. What we're trying to share with you is that if you are eligible for FAFSA and TAP, and that might not cover the 100% of the tuition, that might not cover all the textbooks, that might not cover the uniforms, and so on. So basically, first will go the FAFSA, then TAP. If there is any gap in that, the CPT program will cover that amount. So the funding per participant can vary. It's not the same, okay? But yes, all participants, you need to apply. If it's eligible, good. If it's not eligible, it's good too. But applying is a requirement. And well, a part of what we have at FLIPS, the CPT program are the support services for the CPT participants. We have a strong, I would say the core of the program is the services that the participants they're going to have through their academic life. They're going to have case management that is going to work with them through their application process through the CPT program. As well, we're covering the pre-training and any academic programs that the participant they might need before they start school. We are helping with that. When this participant is already in school, we are having the academic support. A success coach is what we call them. That if a participant for some reason is struggling, is falling behind, if the school shares with us that information, or is the same participant that reach out, that is actually the best thing, that when the participant, before they are at risk, they reach out. We will set up a case manager and the support coach with tutor services for the participant to accomplish their goal, to be able to graduate on time. We have, by the time that the participants are about to graduate, we have a job readiness program that is going to help with placement and support. So basically, it's going to help the participant. This piece of the program is going to support the participants with helping them to get ready to apply in real world. We are going to help them with the resumes, interview process. As well, we are building, we have in development a dashboard where the CPT participants, only CPT participants, are going to be able to log in and basically see what is available through the state of New York with employers that are already approved by the state. And well, same thing. Sometimes it happens that when you are going through the 3 years service commitment, you decide to change employers. If that happens, we can support you through that transition as well. We are offering language services. We understand as the nature of the state, we have different languages. So we are providing services to the participants if they need it. If they are required, we can help you with that, such as sometimes translators, multilingual services, English as a second language as well, if it's necessary. We are going to be working as well with all our partnerships to provide for any additional support, non-academic service that we can provide. And when we were sharing with you, basically, this is on the dashboard that is right now, and we're working on it. The participants are going to be able to log in with their own account. They're going to be able to filter by saying region. Oh, okay, I'm interested in jobs located in Buffalo, New York. You can filter by that. If you want to see individuals, I'm looking for, I don't know, a nurse manager position, you can filter it. I'm looking for LPN, you can filter it out. Basically, it's gonna be like a intended only for the CPT participants. And we are gonna have employers that are approved by the state. And well, right now, basically what at the CPT program, as November 12th, we have at 1,761 individuals enrolled in school. These are through 21 counties, and they are pursuing the 13 job titles. Right now, you can see on the right side of the screen, we have the Accelerated Bachelor of Science in Nursing, Associate Registered Nurse, Certified Medical Assistant, Community Health Worker, the CASAC, Licensed Mental Health Counselor, LPN, Licensed Practical Nurse. A note that I need to make an emphasis right now. We were just talking about the length of the programs, that they must be completed by the spring of 2027. We have a case right now with Master of Social Work. Those are about 2 years long. If participants, they start right now in the spring of 2026, they're not going to be completed by the spring of 2027. But we understand that sometimes participants, they can have an individualized path, might have credits, they might have, they can work with the school, maybe taking classes through the summer, through the winter. But that's something that is basically just if advanced standing is required. That's for the Masters of Social Work. And then sadly, for the nurse practitioner, patient care manager, physician assistant, the RN to BSN, actually, no, I'm sorry. The respiratory therapist, we cannot take more applications. The reason why is because those programs are over 2 years long. And we know for sure that all the schools have said the same thing. They cannot accommodate participants completing the program by the spring of 2027. And well, this is basically on the what we are going to call the 3 phases through the CPT program journey. What we have in the application process, that's the very first step. That's the first phase. We have the first stage is the application process. Here is when you are attending to the webinar, you are learning about the program. If you are ready, we are going to share with you our website, so where you can go and learn more in detail what is the program about, the requirements. If you want to read them again, they're there. And when you are ready, you can start your interest form right there within the website. We have a link that is going to help us to start your account in our system. After that is done, you must complete what we call the second part of the onboarding into the system. You need to activate your account in our system. That's the first step. That's the first stage of the participant application, basically. Then, in the second step, on the stage, we go to pre-services request. The participant, after they have been onboarded and have activated their account, you're going to receive an email saying, hey, we need you to log into your account and submit a pre-services request. When you submit this information, we are going to be able to connect you set up a meeting with your case manager. And well, with the case manager, they're gonna go through your paperwork, if everything is ready or what needs to be done, they're gonna start working with you. When they say, yes, this participant is ready to go to the third stage, that's basically the application itself. We are going to share with you the application form, as well the service agreement, where you are committing to work for 3 years in the state of New York for Medicaid provider, on Medicaid health provider that serves at least 30% of their population is Medicaid or an uninsured. So basically, in the third stage, you're going to receive a form. We are gonna ask you to sign a service agreement. That paperwork is reviewed, that goes through a process, and that's the outcome. Is shared with you that is approved, declined, or maybe sometimes we need some additional paperwork. So that's basically the first step. That's the application piece, the stage phase. Second, we have what is the academic life. You are in school already. You have been approved, you are enrolled, you were approved by the school, the CPT program. We help you with pre-training and academic program readiness. We help you with any training program support that you might need, like coaching, tutoring services. Then as well, by the time that you are ready to graduate, we help you with the educational program completion. Might be if you have to have a certification, exams, license, anything that all the paperwork after you finish school, we're going to help you with that. You have a year by the time that between the time that you graduate and the time that you get all your licenses and your certifications in place or take exams. You have a year in between to start working. So we are gonna be supporting you through that process as well. And well, yes, when the time you graduate, you have your exams, we are gonna helping you with job placement. And same thing, we are gonna help you to the getting ready, resumes, interviews, with a job dashboard that you can go and look for opportunities in your area. And then, well, the third phase is basically the service commitment. This is after you graduate from school. We need to validate the employment. As I mentioned, employers must be validated, approved by the state. And the service commitment starts on your first day of employment. First day of employment, first day of service commitment, that's when the time starts counting. Then, and the next step, yes, sometimes it can happen. You might need to change employers. Well, don't worry. We are there to work with you and help you through that process as well. So you can stay with an approved employer within the area. And then finally, step 9, we have what is the service commitment completion. You complete it, you are done, and you're ready to go and rock the world. So basically, those are the 3 stages. But for you right now, if you are starting the application process, please make sure that when you go into our website, you start that interest form. Make sure that you are giving us a valid email address. We need an exact email address. We had participants that typos happen to all of us, but because the communications are done mostly via email, and yes, we have received cases that they don't use that email address anymore, that is not active, or they did a typo, so communications are lost. The application process, it could take between about no more than 2 weeks. It could take less. But we need a reliable email address so we can contact you, phone numbers as well. That's very important when you complete that piece. If you don't hear from us within saying 2 days, or even 24 hours, please reach out to us at the CPT at flips.org and let us know. We will look and see what is happening with your account. But we are going to do a validation. Basically, we will add your name, the email address that you used to create your account in our system, on the date, some details that can confirm that you have an account in the system. But yes, please make sure that you are using and valid, and the email address that you are sharing with us is you have easy and constant access, because you need to stay on top of the communications to take the steps, because they are released and the order they are completed. Okay. Same thing, pre-services request. If we don't have that information, we cannot connect you with the case manager. If you don't connect with the case manager, we cannot sign an application. So please make sure that you are on top of that. The communications, the application journey is it's not too long, but we do need your constant, we need you to be present and active in that. And well, here we have a list of all the schools that we are in partnership right now. We have from Arnett Health to Utica University. You can see that we have from Buffalo State to Syracuse, Albany. So we are all over the state. Some of the schools, they have online programs. Some of the schools, no. Some of the schools might have online and in person. Some have hybrid programs. That's something that we need you to work with the school, so you can look for the school that fits your, is gonna be the one for you. And as well, we're going to invite you to visit our website, because we are posting right now, if we have a new school, it will be listed on the website. And well, thank you so much for your time. If you have any questions, please feel free to share with us. Right now, here you have, I'm sharing what is our website, healthcarecareersnow.org/CPT. That's where you can go visit the website. You can learn more about the program, the requirements, all the schools available, and the programs that they have available. As well, if you want, you can use the QR code on the screen. And that one as well is going to take you to our website. You can start your interest form, but please keep in mind that just filling the interest form is not an application. And as well, if you have any questions, please send us an email at cpt@flips.org.
Excuse me, Kona. I already sent email to this email for other, reason, explanation. But I'm wondering, I'm not under this Flips program, because I'm not right now not working in New York State, and I'm living in New Jersey. So still this email is acceptable. I ask question.
Yes, don't worry.
I told someone from this, email, there was like phone number, but the person told your case is not totally related to us. You have to go through CPT 1199. I'm so confused. And also the person told, oh, you didn't enroll, like some of program just closed. She didn't help me at all.
I'm sorry.
I'm wondering if I just, disconnect with you, I can't find person just properly help me.
Well, Leila, I know, well, the information that was shared, because the the state where the county where you live, New Jersey, is out of the state of New York. Because the area, county or the area where you live, you need to apply through 1199.
I did.
Mhm.
I
Don't
did.
worry. Send us
But-
information. We are going to reach out to the 1199. We can talk with them to see what's going on. What is the status of your application? You might not be able to apply through us because the county where you reside, but we can help you to find out what is the status of your application in 1199. The three wheels, the three organizations, 1199, Caring Gene, and CPT program flips, we are working in our areas to support you guys.
Okay.
Okay.
I hope so.
Abby, how?
Hi. Hi, this is Abby. So I have a couple questions. I'm from Rochester, but I'm currently living in New York City. I was wondering if I can apply for schools in the Rochester area, like from New York City, or how does that process work? Could I talk to a case manager about that and get an accommodation?
Well, question. Are you temporarily living in New York City?
Yes.
Or is a permanent residency?
Well, I'm living here, yes, but I'm from Rochester. I lived there.
And are you planning to come back to the state, to Rochester, and attend the school in Rochester?
Possibly Buffalo because I went to SUNY Buffalo for
Okay.
undergrad.
Well, send us an email just to be sure. Let me just check. We're going to have that conversation as well to make sure. I don't want to say yes. I can say no. We need to go more, to look more into details, learn more about the situation. Okay.
Okay, thank you. And then also, what is the funding after 2027? Is it through the federal or state government?
We are the federal government. 1199. Okay.
When will you hear back about like other funding, like if you get it for after 2027?
Well, you will, as soon as we hear about it, we will be sharing. Right now is not even on the table. It's not, that conversation is not taking place, sadly. So we cannot say yes, we may have funding, or we know for sure that we're going to have funding until the spring of 2027 for the academic piece. Then we have funding for what is the 2031 until 2031 to support the service commitment. Okay, so we need to be sure that the academic programs are completed by the spring of 2027.
Okay, thank you so much. I'll send you an email.
Okay, thank you.
Have a good day.
Same for you too. Take care.
Okay, I have a last question. So I'm just checking my email, and I got an email like the step one, um, uh, uh, step one email, and it is the GoCo link that I have to click on, and then that is where I have to create an account. Correct?
Correct. That's precisely. You are in the right path.
Okay, I'm going to complete this, and then if I need any help, like I will reach out to you.
Please feel free. And we are looking forward to see and work your application and work with you.
All right, thank you so much. I sincerely appreciate your time and all this information.
No, thank you.
Yeah.
Anybody, I see that is, if anybody wants to stay or wants to make questions, please feel free to stay. We're gonna stay for a few extra minutes.
Again, just a question came in mind, not about my case. Is international student that not working right now because they, they can't work with the student visa off campus and, not professional, are eligible to participate in this program?
Give me a second. We have an address. I'm gonna,
Hello?
yes, I'm here. Just give me
Oh,
just
okay.
I'm gonna share with you in the chat a link.
Mhm.
Let me see if I can do it.
This student is studying pre-nursing and most likely will be like able to get accepted by LPN program that will finish spring 27.
Mhm. Well, right here in the chat, I share with you a link to the website from the Department of Education for what is the definition of a non-US citizen, and that is eligible for federal student aid. Each case is different. I cannot give you advice on that legal advice, but please visit their website so you can learn more. What is the status of the person that we are talking about and what they can do.
Thank you.
You're welcome.